Welcome to my presentation on tuberculosis, a global health challenge. My name is Oluseun, and today I will be discussing the key aspects of tuberculosis, its impact, and ways we can address this global health issue. Tuberculosis, or TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. According to the World Health Organization, TB typically affects the lungs but can also spread to other organs. The disease is mainly transmitted through airborne droplets when an infected person coughs, sneezes, or speaks. While direct contact is rare, TB spreads most effectively in crowded, poorly ventilated areas. Globally, there were about 10.6 million new TB cases in 2023. The highest body is in Southeast Asia and Africa. Sadly, TB caused approximately 1.3 million deaths worldwide in 2023, making it one of the leading infectious causes of death after COVID-19. Main symptoms of TB include a persistent cough lasting 3 weeks or longer, fever, night sweats, and weight loss. The incubation period ranges from 2 or 12 weeks. Treatment involves a strict 6-month antibiotic regimen, usually including isoniazid, rifampin, ethambutol, and pyrazimidine. Population most at risk for TB include people living with HIV, those who are malnourished, individuals with diabetes, and smokers. People in congregate settings such as prisons or shelters are especially vulnerable due to close contact and poor ventilation. Low-income population with limited access to health care are also disproportionately affected. TB can affect all ages, but the highest body is found among individuals aged 15 to 44 years. Men are slightly more affected than women, and the disease is more common among minority groups and immigrants from regions with high TB prevalence. Close family contacts of people with TB are at increased risk. Genetics also play a role as immune susceptibility varies. Mental health challenges and poor access to health care can indirectly increase vulnerability, making it harder for individuals to seek and complete treatment. Social determinants that increase risk include poverty, overcrowding, malnutrition, and poor access to healthcare services. Environmental determinants include air pollution, poorly ventilated living spaces, migration, and conflict situations that disrupt healthcare access and increase exposure. Disparity in TB outcomes are stark. Migrant, indigenous populations, people with HIV, and incarcerated individuals are disproportionately affected. These groups face higher exposure risks and barriers to care, which worsen outcomes. TB screening relies on the tuberculin skin test and interferon gamma release assays. The BCG vaccine provides some protection, especially in children, but is not widely used in the United States and offers limited protection for adults. Current research highlights 3 key hypotheses: the rise of drug-resistant TB due to incomplete or improper treatment, the significant role of HIV co-infection in worsening TB outcomes, and the continued impact of social determinants of health, which fuel persistent transmission despite medical advances. There are several gaps in knowledge, including the need for shorter, more effective drug regimens, the absence of a highly effective adult TB vaccine, and limited data on interaction between TB and conditions like COVID. Recommendations to address TB include expanding rapid diagnostic testing, improving adherence through directly observed therapy, integrating TB and HIV care, and addressing social determinants like poverty, housing, and nutrition to reduce exposure and include outcomes. Research priorities include the development of next generation TB vaccines, digital adherence monitoring tools, genomic studies on drug resistance, and strategies to prevent TB in populations affected by migration and climate change. The World Health Organization NTB strategy serves as a global framework. Locally, implementation involved directly observed therapy programs, community health workers' involvement, and the use of mobile clinics to expand access in underserved areas. Here are the references used to support this presentation, with most being within the last 5 years to ensure accuracy and currency.